Hide and test its p square. Let's learn pharmacology topic adverse effects. एडवर्स ड्रग इफ़ेक्ट्स, कोई भी मेडिसिन देने के बाद कोई अनडिज़ायरेबल इफ़ेक्ट प्रोड्यूस हो रहा है जो हमें नहीं चाहिए, उसे एडवर्स इफ़ेक्ट कहते हैं. ये टॉलरेटेबल भी हो सकता है और इवन सीरियस एंड इवन इन सम केसेस इट इज़ फेटल टू. ये कॉमनली मल्टी ड्रग थेरेपी में होता है. एंड इन केस ऑफ एल्डर्स, adverse drug effects can be classified by many ways such as predictable or type A and unpredictable or type B. predictable mechanism based adverse effect होता है जो कि एक फार्माकोलॉजिकल प्रॉपर्टी होती है ड्रग की. एंड अनप्रेडिक्टेबल होता है जो वो एक्शन के डिपेंड नहीं करता, जैसे कि ड्रग एलर्जी. अब एडवर्स इफेक्ट को प्रिवेंट कैसे करें? हम इसे प्रिवेंट कर सकते हैं जैसे कि हम पेशेंट को अनरिक्वायर्ड मेडिसिन ना दें और पेशेंट को डिज़ायर डोज, रूट और फ्रिक्वेंसी ऑफ ड्रग ही एडमिनिस्ट्रेशन करें. और इसमें पेशेंट की प्रीवियस हिस्ट्री एंड मेडिकल हिस्ट्री बहुत इंपॉर्टेंट है, जो हमें बताती है कि पेशेंट को कोई ड्रग एलर्जी तो नहीं. अगर उसे कोई एलर्जिक डिजीज़ है दैन इन दैट केस ड्रग एलर्जी इज़ मोस्ट कॉमन. अगर हम एक से ज़्यादा ड्रग प्रिस्क्राइब कर रहे हैं दैन वी रूल आउट पॉसिबिलिटी ऑफ ड्रग इंटरेक्शंस. Adopt correct drug administration technique. For example, intravenous injection of vancomycin should be given slowly. Correct laboratory monitoring should be preferred. For example, prothrombin time in case of warfarin. Adverse drug effects may be categorized into side effect, वो unwanted and unavoidable effect जो कि थेरेपेटिक डोज पे मिलता है. वो सेम भी हो सकता है थेरेपेटिक इफ़ेक्ट के साथ, जैसे कि एट्रोपिन हम यूज़ करते हैं एज प्री एनेस्थेटिक मेडिकेशन बिकॉज ऑफ इट्स एंटी सिक्रेटरी एक्शन, बट द सेम एक्शन प्रोड्यूस ड्राइनेस ऑफ माउथ एज अ साइड इफ़ेक्ट. ट्राइनाइट्रेट हम यूज़ करते हैं टू रिलीव एंजाइना पेक्टोरिस विच डू सो वाई डायलेटिंग पेरिफेरल वेस्कुलेचर विच रिजल्ट इन postural hypotension and thrombing headache. The side effect may be unrelated to the pharmacodynamic effect of the drug. For example, promethazine have anti-allergic action but it produce sedation as a side effect. Estrogen cause nausea which is unrelated to its anti-ovulation action. एक इफ़ेक्ट एक केस में थेरेपेटिक भी हो सकता है और वही इफ़ेक्ट दूसरे केस में साइड इफेक्ट भी. फॉर एग्जाम्पल, कोडेन यूज्ड फॉर कफ प्रोड्यूसेस कॉन्स्टिपेशन एज अ साइड इफेक्ट, बट दैट सेम साइड इफेक्ट इज अ थेरेपेटिक इफेक्ट इन केस ऑफ ट्रैवलर्स डायरिया. सेकेंडरी इफेक्ट्स, वो इफेक्ट जो कि ड्रग के प्राइमरी एक्शन के कारण आ रहा है. फॉर एग्जाम्पल, टेट्रासाइक्लिन सुप्रेस करता है नॉर्मल बैक्टीरिया फ्लोरा को रिजल्टिंग इन सुपर इन्फेक्शन. सिमिलरली, कॉर्टिकोस्टेरॉइड होस्ट की डिफेंस मैकेनिज्म को वीक कर देता है रिजल्टिंग इन लेटेंट ट्यूबरकुलोसिस. टॉक्सिक इफेक्ट्स, रिजल्ट ऑफ एक्सेसिव फार्माकोलॉजिकल एक्शन ऑफ अ ड्रग ड्यू टू ओवरडोज और प्रोलॉन्ग्ड यूज. ओवरडोजेस मे बी एब्सोल्यूट लाइक एक्सीडेंटल, होमिसाइडल और सुसाइडल, और इट कैन बी रिलेटिव. एग्जाम्पल, यूजुअल डोज ऑफ जेंटामाइसिन इन प्रेजेंस ऑफ रीनल फेलियर. और टॉक्सिसिटी may be due to extensions of the therapeutic effect itself. For example, coma by barbiturates, complete AV block by digoxin, and bleeding due to heparin. Other examples are overdoses of morphine, which is an opioid analgesic, cause respiratory failure, and prolonged use of streptomycin, which is an antitubercular drug, cause vestibular damage. Intolerance, it is opposite to that of the tolerance, in which toxic effects are seen at therapeutic doses due to low threshold of the individual to the action of drug. For example, a single dose of triflupromazine induce muscular dystonia in some individuals, especially in children. Few doses of carbamazepine may cause ataxia in some individuals, and in some occasional patients, one tablet of chloroquine may cause vomiting and abdominal pain. Idiosyncrasy, it is very interesting as it is genetically determined abnormal reaction to a drug which interact with some unique features of the individual, and it is not found in majority of the subjects. and produces uncharacteristic reactions such as barbiturates cause excitation and mental confusion in some individuals. Quinine cause cramps, diarrhea, purpura, asthma and vascular collapse in some patients. Drug allergy, also called as drug hypersensitivity, it is immunological mediated reaction producing symptoms which are unrelated to the pharmacodynamic profile of the drug. Please do not confuse with supersensitivity, which refers to increased response. The target organ primarily are skin, airways, blood vessels and gastrointestinal tract. It is divided into two types as humoral and cell mediated. Humoral is further divided into three subtypes as type 1, which is called as anaphylactic reaction, type 2 cytolytic reactions and type 3, and cell mediated is also called as type 4 or delayed hypersensitivity reaction. This can be defined by a mnemonic as acid. A stands for anaphylactic reaction, C for cytotoxic, I for immune complex mediated and D for delayed hypersensitivity. Photosensitivity, if we split the word as photo and sensitivity, photo indicates that it is related somewhat to that of light. Yes, it is related to UV radiation. In this cutaneous reaction resulting from a drug induced sensitization of skin to UV radiation, it is of two types as phototoxic and photoallergic. In phototoxic, drug or its metabolite accumulate in the skin which absorb light and undergo photochemical reaction followed by photobiological reactions resulting in localized tissue damage such as in sunburn and cause arrhythmia, edema, which have faster onset and short duration after exposure ends. Phototoxicity is due to UV type V radiation which have a shorter wavelength, that is 290 to 320 nanometer. Second type is photoallergic, in which cell mediated immune response is induced by drug or its metabolite which on exposure to light of UVA radiation which have long wavelength of 320 to 400 nanometer produce papule or contact dermatitis like picture which may persist longer after exposure. Drugs involved are sulfonamides, sulfonyl urease, chloroquine, chlorpromazine and carbamazepine. Drug dependence means drug पर निर्भर हो जाना, in which use of drug for personal rather than other basic needs, often in face of known risk of health. This is common in drugs capable of altering mood and feelings are liable to repeated use to derive euphoria, withdrawal from reality and social adjustment. It is of two types as psychological or physical dependence. Psychological dependence, the individual believes that the well-being of his body is only due to the action of drug, and if drug is not taken, the individual feels emotionally distressed. Physical dependence, body needs continuous presence of drug to maintain physiological equilibrium. It is due to altered physiological state produced by repeated administration of the drug, and discontinuation of the drug result in characteristic withdrawal symptoms which mainly includes restlessness and tremor. Let's understand three terms: drug abuse, drug addiction and drug habituation. Drug abuse. In this, individual take drug in a manner and amount higher than that of approved medical and social patterns in a given culture at a given time. It is of two types as continuous and occasional. In continuous, the individual take drug regularly such as opioids, alcohol and sedatives. In occasional, the drug is taken off and on to obtain pleasure or a state of high or for recreation. Example: cocaine, amphetamines, alcohol, cannabis, etc. Drug addiction, it is pattern of compulsive drug use characterized by overwhelming involvement with the use of drug. Example: cocaine, cannabis, which produce addiction but little or no physical dependence. Drug habituation, it denotes less intensive involvement with the drug so that its withdrawal produces only mild discomfort. Example, consumption of tea, coffee, tobacco, social drinking are regarded as habituation. In this, physical dependence is absent. Drug withdrawal reactions, apart from the drugs that are usually known to produce dependence, sudden interruption of the therapy with certain other drugs also result in adverse consequences, mainly in most of the form of worsening of the clinical condition from which the drug has been given. For example, frequency of the seizures may increase on sudden withdrawal of an antiepileptic, or worsening of angina pectoris or precipitation of myocardial infarction may result from sudden stoppage of beta blockers. Acute adrenal insufficiency may precipitated by abrupt cessation of corticosteroid therapy. Teratogenicity, it is very important short note. It refers to the capacity of a drug to cause fetal abnormalities when administered to a pregnant woman. Placenta as is not a strict barrier and many drugs can cross it to a greater or a less extent. And embryo is one of the most dynamic biological system in which drug effects are often irreversible. Drug effect at 3 stages. First, fertilization and implantation. Second, organogenesis, which is most vulnerable period. It is from 13 days to 55 days. And the last is growth and development. Good example for this is thalidomide disaster, in which thousands of babies born with phocomelia, that is hands and feet directly arises from the shoulders and pelvis, similar to flippers of a seal, known as seal-like limbs. It has been noticed that it is due to an anti-morning sickness drug known as thalidomide, and it was then banned all over the world. This is FDA risk categories. It is of 5 types: A. No risk. B. No evidence of risk in humans. C. Risk cannot be ruled out. D. Weight benefits against potential risk. And X. Contraindicated. These are the 3 stages on which drug can affect the fetus. Example, ACE inhibitor can cause hypoplasia of organs, especially of lungs and kidneys. NSAIDs can induce premature closure of ductus arteriosus. Androgen and progestin cause muscularization of female fetus. Antithyroid drugs and lithium cause fetal goiter. Mutagenicity and carcinogenicity, it is referred to capacity of drug to cause genetic defects and cancer respectively. Usually oxidation of drug result in production of reactive intermediates which affects gene and cause structural damage and changes in chromosomes. Even without interacting directly with the DNA, certain chemicals can induce malignant changes in genetically damaged cells, resulting in carcinogenesis. Chemical carcinogens generally take several years to develop. Drugs implicated to these adverse effects are anti-cancer drugs, radioisotopes, estrogens, and tobacco. Drug-induced diseases, also called as iatrogenic or physician-induced diseases, they are functional disturbances caused by drug which persist even after the cessation of the drug and largely eliminated. For example, peptic ulcers by salicylates and corticosteroids, Parkinson by phenothiazines and other antipsychotics, hepatitis by isoniazid, DLE by hydralazine. Thanks. Make sure to share the knowledge with your friends. Keep supporting.